Hi everyone. So I was going to go over that again. Welcome. My name is Dana Howarth. I'm the Deputy Director. I got promoted. I keep forgetting. Of the New Mexico Caregivers Coalition. This is a guest presentation with Samantha Morales. She works for the Senior Medicare Patrol. Today's presentation is going to be on Medicare coverage of emergency services and urgent care. Before I pass it on to Samantha, just a quick little housekeeping. Valerie Sosi, if you want to say hi real fast.
Hello, yeah, thank you for coming to our class today. If you have any questions, if you could put them in the chat. It looks like Zoom is obviously having some issues. So if you can put your questions in the chat, it'll be easier for us. Thank you.
Thanks, Valerie. Valerie is going to be taking attendance in today's class. So if you haven't already introduced yourself in the chat or didn't change your name on the screen, make sure she can see your name so she can mark you here. Like she said, Zoom's being kind of weird with the unmuting. So I think it'd be easier if everyone could just put questions in the chat instead of trying to verbalize them out loud since it keeps echoing weird. Samantha Morales will do her whole presentation and then do a Q&A at the end of her session. So hold on, put them in the chat, and then Valerie and I will read them to her at the end. If there's any other questions, feel free to put those also in the chat. So now I'm going to pass it on to Samantha.
Thank you so much, and happy Friday, everyone. And thank you again for your time and spending part of your Friday participating in this important training. I hope it's going to be an engaging discussion for you. I would like also to extend, of course, my gratitude to Dana, my gratitude to Valerie and the New Mexico Caregivers Coalition for having me once again, for providing this opportunity to present to this engaging network of advocates and caregivers. So thank you so much for having me. And with that, Dana, whenever you're ready, there you go. Perfect. Wonderful. So we'll jump in. Perfect. So in today's training, we're going to discuss each one of these items. So the focus is going to be on the part of Medicare that's called Part B. It's the part of Medicare that covers emergency services and urgent care. And so we'll kind of get into some of those definitions, the way that Medicare views these two types of services. We'll also get into some of the hairy situations with Medicare billing issues when it comes to these types of services, right? Especially with ambulance services that we'll get into later. And of course, I always like to apply these complex Medicare concepts to case studies, real life situations that you may encounter. And so we'll do that at the end as well. So with that, if we can go on to the next slide. And many of you, I'm sure, this will be review for many of you who have attended trainings that I have facilitated. So I'm just going to go through this spiel briefly, and this is just really an introduction to the SMP program, just to let you know that we exist. The Senior Medicare Patrol is the full name of the program. We are federally funded to do this type of community outreach work and one-on-one counseling for Medicare people who are enrolled in the Medicare program who are dealing with different types of Medicare billing, fraud, those types of issues, or if they just have general Medicare billing questions that they want to ask about or they need assistance about. So in terms of our mission, we are there to empower all of you as caregivers, obviously. So we work with Medicare beneficiaries, their families, caregivers. We want to make sure that folks have the tools, have the information to prevent, detect, and report on healthcare fraud issues, errors, and abuse. And we do this through outreach, counseling, and education. And all of our services, I should say, we are a state agency. We are a program that's housed within the state agency of the Aging and Long-Term Services Department, specifically the Aging and Disability Resource Center, the ADRC. So everything that we do is completely free and open to the public. And with that, Dana, if we can go on to the next slide, that's also going to be a brief review, especially for folks who have attended these types of trainings that I have facilitated. So Again, this is just another review slide that provides important information about the Medicare program. So very briefly, when we're talking about Medicare, we're talking about a federal health insurance program, the program that was created in 1965 that was signed by President Lyndon B. Johnson, right, to protect Medicare, I should say before even Medicare was created, to protect older adults who could not be insured, right, to bring them into a safety net. So these are folks that are age 65 and older, for example, and also folks who are living with a disability, who have a disability status with Social Security Administration, and other populations who may be eligible according to their diagnosis, for example, like people who are dealing with end-stage renal disease, for example. Unfortunately, the program, as good as it is, in my opinion, as robust as it is, it's still not, it doesn't cover things at 100%, right? It wasn't designed to cover everything at 100%. Medicare, people enrolled in the Medicare program will still face a cost sharing. So typically, if Medicare pays 80% on a Part B service, people will have a 20% cost sharing. So there is some, cost that people will be facing. Now, in terms of how big this program is, it continues to be the most important public health insurance program in our country. That 61 million number is growing. It's probably much bigger because I cited that number from a 2019 Medicare trustees report. So it's much larger, right? And the percentage of people who are older adults, for example, is the vast majority of people on Medicare, but it's still a large percentage of people, like 8.7 million, according to that 2019 report, were disabled folks. So it's a very, very important program to cover some of our most, high needs, vulnerable communities. It's very important. So with that, let's go on to the next review slide. And I call it review because you would have seen this if you've taken these trainings before. And I really don't want to linger too much. I like the map though, because I like us to begin from a place where we can see what is the Medicare program in a picture, right? It's composed of these two very important components. When we speak of Part B, which is what this training is focused on, it's medical insurance, it's outpatient care. It's the part of Medicare that will pay those claims when people go to see their doctors, when people get preventive care. And yes, the whole purpose of this conversation is emergency services. That's going to be covered under B. Part A is extremely important for people to have as well. It's hospital insurance. So operations, major operations where people have to be inpatient, that's going to be covered under Part A, right? So both of these programs together, A and B, compose original Medicare, the traditional Medicare program. Now, again, just to give everyone that language, right, of that Medicare language, Part C is another way of saying private plans, Medicare Advantage plans. Those are plans that people can receive as an alternative way of receiving their Medicare benefits, where they get Part A, they get Part B, they get their drug coverage all in one plan. They get one card in the mail through these different companies, whether it's, if they choose United Healthcare, if they choose Molina, if they choose, et cetera. There's a variety of these different plans. It depends, their cost sharing is different. Their networks of providers are different. Depending on where people live, there could be more plans or less. It's not mandatory. People choose to enroll in these plans if it works better for them. The Part D component is outpatient prescription drugs through Medicare, right? That's the part of Medicare that will cover those prescriptions when people go to the pharmacy. When you're going to Walgreens, you're going to CVS or wherever, the mom and pop shop in your neighborhood, where you pick up your doctor's prescription medication, it's that part of Medicare, if you have a Part D plan, that's going to pay out, right? So all of these different components kind of become this comprehensive health insurance coverage to cover the Medicare, the person enrolled in Medicare. So with that, let's continue on and build on this conversation. Let's get into the actual conversation of today's training. Again, we're going to move on to the next slide, and we're going to delve right in. And we're going to start with Medicare's definition of emergency and urgent care services. What are they, right? How does Medicare view this? And so just starting from the top, it's a lot of a lot of information that I included here, but I kind of wanted to break it down. So it starts really with the definition. emergency services, the way Medicare views it, they're covered both inpatient and outpatient services that a person receives from a provider who's qualified to give those services, right? So these services evaluate or treat an emergency medical condition. And then, before we jump into kind of the checkpoints there, what I wanted to say more about an emergency medical condition, according to Medicare, really it's a condition where the symptoms are so severe that someone with an average knowledge of health and medicine could reasonably expect the beneficiary's health to be in serious danger. In other words, Medicare is using, what is the term, like a layperson's definition of an emergency. Literally, if you're walking down the street and you're seeing someone who looks to be in a crisis type health situation, even if you're not a medical provider, that's what Medicare is looking at. It's just any average person who's not a doctor, who is not trained in medicine, can view a situation and determine that person looks like they really need medical attention immediately right now, because it looks like they're in some type of a medical crisis situation. So that's where that's important. And then just kind of, walking through the slide a bit more with these checkpoints, an emergency medical condition, again, can result in, as we listed in the slide, a danger to the person's health, right? So, and if the person is a pregnant individual in the Medicare program, the health of the unborn child, right? Because we have younger people under the age of 65 that are on Medicare due to their disability. But the point is that this type of an emergency medical condition can cause a serious damage to bodily functions, parts, or organs. So this is where anyone can see that something's happening with this person, right? In terms of urgent care, urgent services, those are covered, and the definition is a little bit slightly different. So it's not emergency services as we state defined, above, but they're medically necessary and they're immediately required. That's the point. The medical necessity is important, and the immediacy of providing these services in that moment that the person is in crisis is important to remember when keeping these types of things in context. We don't have to memorize the differences between these definitions. It's just important to consider that Medicare really is just, if the person feels like it's an emergency or it's an urgent care situation, they should pay, right? That's the point. And again, the other pieces to that is it's important to remember that if the beneficiary receives care when they are temporarily outside of their Medicare Advantage plan service area, or when they're in the plan's area and a network provider is unavailable, that Medicare Advantage plan will be mandated to cover those services. They can't just deny it because the person is out of network. So it is important that this kind of gets into more of what we're going to build on in the discussion, but it gets to the person who has Medicare. They have rights and protections when we discuss emergency and urgent care services, right? When it comes to private plans and some of the rules that these private plans impose. And with that, I know that was a lot of information, but I'm going to go on to the next slide. And this gets into, well, kind of, what about the emergency room services? Once people are kind of go to the hospital, right? And they're going to the emergency room. So again, it's the Part B that we're focused on. And with Original Medicare, again, Part B covers emergency room services anywhere in the United States. And that's really important to emphasize. So anywhere where a person needs help and it's an emergency and they need medical attention and they're on Medicare, they can go to any facility, any hospital to receive that care. And then in limited circumstances, you're going to find it interesting, or at least I do because I'm a major Medicare nerd. In limited circumstances outside of the United States, Medicare Part B may cover emergency services. And so I kind of walk down, and I'm going to provide more explanation of those circumstances, but in these check marks, just to kind of complete the slide. So emergency room services, again, are typically provided when the beneficiary has a medical condition that requires immediate action, right? An injury, sudden illness, a person fainted, they're not breathing. Again, it requires immediate medical attention. The last point there is about cost. what can people expect to pay, right? So after they pay for the deductible, the Medicare deductible, the person will be responsible typically for 20% co-insurance charge, and that's for doctor services. And again, we want to encourage always that people go see providers that accept assignment, but sometimes in an emergency, you don't have a choice of where you go. But typically this is the cost sharing, right? There is a responsibility, 20% responsibility, typically once people receive these types of services. So with that, let's move on to the next slide, please. Wonderful. So what about transportation, right? When it comes to emergencies, and that gets down to, let me make sure that I have this right. Yep, transportation. Where am I? Okay. Wonderful. So in terms of transportation, how does Medicare view this and how does Medicare cover this? So it can be a bit complicated with ambulance services, right? So it is important to inform people on Medicare, the folks we're caring for, that an ambulance it has to be medically necessary, right? So meaning, and here we define it in that first, check mark, meaning it's the only safe way to transport the beneficiary to where they need to go, the hospital, the medical center, whatever the case may be, right? So that's where, so the first part of the slide is the criteria for coverage, how Medicare covers ambulance services under Part B. So they have to meet these checkpoints on the top, right? So the reason for the trip, the second bullet point, is to receive Medicare covered services, or to and from that location, right? Then the third bullet point, the person is transported to and from certain locations following Medicare guidelines. So they can't just go anywhere. It has to be the nearest medical center to the emergency. If the emergency was in the person's home, for example, they have to go to the nearest hospital. That's where the ambulance is allowed to take them for Medicare to cover it. It's the nearest location that's reasonable, that's appropriate for the type of emergency that the person is going through. The last bullet point in that first part, and the transportation supplier meets Medicare ambulance requirements, right? That's the tricky one that I've seen where people run into trouble, where they receive, ambulance services, but they receive it through an ambulance company that's not fully certified by Medicare. It's not fully equipped. It doesn't meet the definition of an ambulance transport, that's a Medicare covered ambulance transportation type vehicle. That means they have to have, staff. That's the people staffing the ambulance company. They have to receive, the types of training that Medicare will cover, that they have to provide medical care and services, and they have to have that level of training. The other piece is that the ambulance has to be equipped with the type of technology that, in order for Medicare to cover it. So there's differences in the types of ambulance transportation type vehicles that Medicare will cover. So that's another piece. It's like, is the ambulance just a volunteer ambulance type company? That's kind of the first one to respond. Or is it affiliated with a hospital, right? Is it affiliated with a medical center and it's fully equipped with the staff that are trained to provide this type of medical attention? So there's specific requirements that I don't want to get too much in the weeds, but it's just important to keep that kind of as part of the conversation. Well, what type of ambulance transportation vehicle is this? Is it the type that Medicare will cover? Just in the back of our minds, because that's really, a big part of where we see billing problems, right? Because this type of company is the first one to respond. And then of course, how can people, when it's an emergency, you need the care, and you need to, so there are ways, and I want to emphasize how the Aging and Disability Resource Center can provide more one-on-one assistance, either through the Senior Medicare Patrol Program or the State Health Insurance Assistance Program, when there is an ambulance billing issue that comes up. Because you don't have to figure this out by yourself. We're definitely trained to provide more research and more assistance in looking at these issues. But I did want to highlight that because it is an issue that is a common one, and it's not a new issue that we see, especially in rural communities. So the bottom part of this slide, before we move on, now to be eligible, so there is such a thing as transporting people via ambulance. when it's not an emergency and having Medicare cover it. How is that possible? So we listed the 2 criteria here that people, Medicare eligible people enrolled in the Medicare program have to meet in order to get assistance for non-emergency transportation. In other words, maybe they have to go to their dialysis treatments, once or twice a week, and they have a doctor's order to be transported via ambulance. Well, in order to do that, in that scenario, in that situation, the person, for example, has to be confined to a bed, right? They're unable to get up from the bed without help, unable to walk, they're unable to sit in a chair or a wheelchair. So the ambulance becomes the only secure way, the safest way to transport a person in that condition, right? Now, the second bullet point, if that's not the issue where the person is confined to the bed, there could be a situation where the person needs essential medical services during the trip. And we list some examples here, right? That they're only available via ambulance, like the administration of medications, maybe the monitoring of vital functions during the trip. So the person has a high need medical condition that requires the type of, expertise from the ambulance staff members, the folks that are trained to provide that type of monitoring or medical attention in that moment to transport the person safely to where they need to go, right? So I wanted to highlight that there is such a thing as Medicare covering non-emergency ambulance services, but people have to meet the criteria for coverage. And with that, we're going to move on. And please stop me, Valerie or Dana, if I'm going too quickly. I am more than happy to take a pause because I know some of this can be, especially with ambulance, I even do a double take because these rules can get really complicated really quickly depending on the person's situation. But again, I want to give just the very basics and give the language to you all so you can identify certain issues as they come up in, if you're caring for someone who needs to use these emergency services. And if you need assistance, you have the resource of where you can go to get more information or assistance from us, right? Okay, so in terms of locations, where is Medicare going to cover the transportation, right? The Part B covered ambulance services to and from, where are those locations? So here we list some of those. So it really just depends, like if it's the person's home or any other place where there's an emergency. Maybe they are, I don't know, they're out, they're at, visiting a family member, etc. They're at a community center and they have an emergency, they call the ambulance, they will go there, Medicare will cover for that pickup and they will take the person to the nearest facility that's appropriate, whether it's the hospital as we list here or a skilled nursing facility, etc., a medical center that's the closest one, right? Medicare will cover that. So if the person is hospitalized or maybe they're in a skilled nursing facility, maybe the person needs to go back to their home. They're being discharged. There could be, Medicare could pay for that transportation back to the person's home if that's the safest way to bring the person home. Because again, the person needs that type of ambulance care. Maybe it's going to the hospital. Maybe the person is in a skilled nursing facility, but they need other services in a hospital setting that they can receive treatment only in that hospital setting. So the ambulance can take them from the skilled nursing facility to that medical center, to that hospital setting so that they can receive that type of treatment that the skilled nursing facility will not provide, right? So those are some of the things to think about. And I think I get into that point in that where it's from a SNF or a skilled nursing facility to the nearest medical provider. Of course, Medicare adds all these caveats. If the skilled nursing facility is not providing the necessary treatment because they don't have it, for example, some cancer treatments, intravenous cancer treatments that need to, chemotherapy, for example, that needs to be provided to someone who is rehabilitating and getting skilled services in a skilled nursing facility, they may need to go to a hospital to receive that chemotherapy. So an ambulance may be the safest way to take that person to that facility. And again, to the home, from the home to the nearest renal dialysis facility and back, if the person really meets the criteria to receive that type of non-emergency ambulance transportation. And with that, Dana, I'm going to ask to go on to the next slide. And this is just another it's another reminder slide, I guess, about costs. Like, how much do these things cost, right? How expensive is this to the Medicare beneficiary and their family? So if the person has original Medicare, again, that 80-20 percentage applies, right? Where Medicare will pay for the emergency ambulance, typically those services at 80%, and then there's a 20% co-insurance. After the person pays for that deductible, the Part B deductible, and this year, the deductible is $233. So that means that, the family, the Medicare beneficiary will have to pay $233 before Medicare pays anything on that ambulance service. And then once they hit that 233, Medicare pays 80%. Whatever is left over is the responsibility of the Medicare beneficiary. When it comes to Medicare Advantage plans, it can be tricky, right? Because these plans, even though they are required, mandated, they don't have a choice. They have to cover emergency services, urgent care services. They have to. However, Medicare allows them to impose their own cost sharing, different cost sharing to these types of services. So it's important for people who have a Medicare Advantage plan to be proactive and make sure that they're communicating, calling the plan directly, speaking with a plan representative, looking at their benefits booklet to understand how emergency ambulance services are covered, right? So that they understand what the cost sharing is. Maybe there's a set amount. Maybe the person has to pay, a copayment of $300 for ambulance services. So it's important to understand kind of what the Medicare Advantage plan rules and the cost sharing is for these types of services. Because it could be different, and it may be the same, but they can impose their own cost sharing. So with that, let's move on to the next slide. So this is another one that's interesting to me, because this is just kind of to highlight how Medicare will cover, for example, these different types of emergency services. So air ambulance transportation is huge in our state, right? Especially for rural communities. So it is important, it's relevant for us in our state, and it's important to know what these coverage rules are. So again, it's going to be Part B that we're going to be dealing with here. So, and that Medicare will cover transportation via air ambulance if these conditions, like these checkpoints here, kind of, if this is what the person's situation is, right? So again, the medical necessity piece is always going to be important, right? There's a medical need for this person to be transported in the first place. And then in addition to that, Medicare is going to look at, well, what about ground ambulance? Is that something that can be possible, right? So again, the service must be needed either because, again, a ground ambulance cannot get to where the beneficiary is located. So Medicare is going to look at that, the accessibility of where the person lives. Is the person in a rural community, or are they in an urban area, right, where they have more access to maybe ground ambulance? Or there's a great distance to travel or another obstacle involved in getting the person to the nearest appropriate facility. So if there's a great distance, if the person is located in a rural community and it's greater distances for them to get to the nearest hospital, that's where air ambulance transportation may be appropriate. And again, the third bullet point here, again, in rural areas, like in many of our New Mexico communities, people will automatically meet the medical necessity requirement if they have a doctor's support, right? If a doctor determines that air transportation is necessary due to time and geographical factors, maybe the person needs, open heart surgery right away, and they live in a rural community and they have to be transported to a major hospital to receive that care. So this is what Medicare looks at. The other piece is, and the air transport meets Medicare approved air ambulance requirements. So without getting into the nitty gritty of what those requirements are with these air ambulance companies, it is important to think about that there are Medicare approved air ambulance companies that are kind of equipped with the necessary medical equipment to meet the needs of a person in an emergency. So it can't just be any type of air transportation company that will take the person. It has to be one that's equipped to do it with the right staff that can provide that assistance. So keeping that kind of in the background there as well, just like with ground transportation ambulance, It's thinking through, well, it has to be an ambulance that's equipped to provide that type of transportation. The last reminder note that for me is always very important in these discussions is the rights of Medicare beneficiaries who are enrolled in private plans. So it's always important to remind them that these plans, Medicare Advantage plans, whatever type of plan you have, they don't have a choice. They can't say, we're not covering this, it's too expensive, good luck to you. Medicare mandates them to cover air ambulance transportation. However, we always write that caveat, they can do so at different costs and they can impose different restrictions. So it's important to ask those questions, especially if you're in a rural community. Check in with that Medicare Advantage plan and ask, well, how do you cover air ambulance transportation? Where is it written in my benefits booklet? I need to know how much it would cost if I have a major emergency, or if the person I'm caring for is going through a major emergency. So with that, we can go on to the next slide, please. In this section, we get into some of these kind of more complicated issues with billing and the coverage of these services. So let's move on to the next slide here. So here are just a few things to think about. And again, with all of these types of trainings, you don't have to memorize anything at all, because again, you're going to have access to these slides. And at the end, I always give links to resources that you may find helpful. So in this discussion, I really wanted to bring out, focusing on private plans, because these are issues that we often hear about when it comes to out-of-network providers. So again, Medicare Advantage plans, as I mentioned, they're required to cover emergency and urgent care anywhere in the US. And they have to do that without imposing additional costs or coverage rules. So for example, they can't just say, you need prior authorization. You needed prior authorization when you received emergency services out of state because you had an emergency. They can't do that. So I'm going to walk through this slide because again, this gets into the rights that Medicare beneficiaries, people enrolled in the program have even if they're enrolled in a private plan. So even if a person, the first bullet point there that I can walk through, even if people receive care from an out-of-network provider, the private plan must cover the care as if the person had gone to an in-network provider, right? So that means, we always tell, be proactive after the crisis, of course, and let the doctors know, the doctors who treated the person know, please contact the plan for information about how you can submit the claim. It's always good to be proactive so that the doctor can let the plan know, yes, we're out of network, but this was an emergency. So that's always just a note of how to be, advocate and be proactive so that there's no billing to prevent billing issues. Now, in terms of the way that private plans define an emergency, the language that Medicare uses is prudent person standard. And really that's kind of just a very complicated language just to say a layperson's definition of what an emergency is. So we had already discussed how Medicare views an emergency. It's really any average person who doesn't have a medical degree. You don't need a medical degree. You just have to be a person who can recognize that there could be a medical emergency that's happening to another person. So that's what Medicare Advantage plans operate under. That's the definition that they view. So, and again, just to mention that last bullet point there, this is the standard that ensures that even if the beneficiary's condition turns out not to be a medical emergency later, because maybe the person just had, an anxiety attack and it turned into something that they were calmed and they were helped in the emergency room. Even if that happens, it's still in the moment, the person was having a crisis and an emergency. And so the plan has to cover those services because in that moment, the person needed medical attention. So that's really what that means to distill what, prudent person standard means. It just means an average person who can see that a person is having a medical crisis and needs medical attention immediately, right? Emergency services. So with that, I'm going to kind of pause and move on to the next slide. And this one's tricky. I really enjoy talking about opt-out providers. And I say this because I enjoy warning people about opt-out providers because it's never a good idea for people enrolled in the Medicare program to see an opt-out provider, right? People should stay away. And I mean that because opt-out providers, as you'll see in these bullet points here in the top of the slide, they are providers who have agreed not to accept any of Medicare's payment. They don't want anything to do with the Medicare program. They can't bill Medicare. Medicare has them registered in their system as opt-out providers. This status as opt-out provider means that they're not going to accept Medicare's payment. Medicare can't pay them. So these providers can be very problematic for people, right? So original Medicare, as we list here in the second bullet point, and Medicare Advantage plans, they will not pay for services that people receive from opt-out providers, right? So people will have to pay for that entire care out of pocket. That could be very expensive. So people really have to think twice before they engage with an opt-out provider. Now, if a person sees an opt-out provider for non-emergency services, the person, that doctor or that whatever type of provider it is, they have a responsibility to inform the Medicare beneficiary in writing. So this gets to the person's rights. The person has to be informed with a private contract describing that the charges for the services they will have to cover. They will have to cover out of pocket before they receive the services. Otherwise, it's fraud, right? The opt-out provider doesn't. How do we know a provider is an opt-out provider? Excellent question that I can address in this moment. Now, the best way to do that, I always tell people proactively, when you go see a new doctor, if you're caring for someone who has to make an appointment to see a new provider, you really want to ask that doctor's office, are you a doctor who accepts Medicare? And if you want to even ask a more direct question, what kind of doctor in the Medicare program are you? Are you a participating provider? Now, if you're in a Medicare Advantage plan, you want to stick to in-network doctors, but that means going in the network of the plan, starting with the plan. So it's a little bit different because you're dealing with the plan's network. But with original Medicare, if you're caring for someone, or if you're a person on Medicare who uses their red, white, and blue card, and you can go to any doctor because any doctor that accepts Medicare. So it's always important to get back to your question. Just start when you're making the appointment and you're engaging with the staff member, just ask the staff, I have original Medicare. This is my health insurance through Medicare. Do you accept Medicare? Because if they are an opt-out provider, they have to tell you. It's a responsibility. They have to not only tell you verbally, but they have to tell you in writing when you go to their office before you get their services. They have to give you that private contract. So in a way, it's almost very easy if they're very ethical, right? Because I've seen opt-out providers that give the contract after the person received the services, which is completely fraudulent. So just keep that in mind with that status. Opt-out providers is one of those providers that exist in the Medicare world that people in Medicare really want to stay away from, right? Because they're going to pay out of pockets. If it's an emergency, that's where it gets a little different. Now, moving towards the bottom of that slide, the only exception of when Medicare will issue a payment, and you're very welcome, Elizabeth, thank you for your question. So the only time that Medicare will pay for opt-out provider services because it's an emergency and maybe the only doctor available was an opt-out provider is in emergency situations. And that's the point of that bottom slide and of that bottom half, right? Those two bullet points. It doesn't matter if you use original Medicare, the red, white, and blue card, or if you're in a Medicare Advantage plan. If you're in an emergency room and the only doctor that is attending that comes to see you you find out later that it's an opt-out provider, Medicare will cover those services because it's an emergency. So with that, I think that is pretty clear. Just the only exception to this rule with opt-out providers is emergency services, right? Everything else, if it's not an emergency, people will pay out of pocket. So with that, let's move on to the next slide there. Now, this one's interesting as well, and this applies also to our state, especially in the southern region of the state, right? Because the border with Mexico, for example, we're not anywhere near Canada, but we do have a border with Mexico. So this is all about how Medicare covers emergency services when a person is in a close proximity to one of our foreign neighbors, whether it's Canada or in our case, it's Mexico, right? So Medicare will issue payment actually in specific, very specific situations. So, and I'm going to walk through this slide because I don't want to miss anything. And again, when we say original Medicare covers it, we mean Medicare Advantage plans must cover it too, right? So in certain circumstances, Medicare again will issue payment for emergency services received in another country in the following conditions. The first bullet point, Medicare will pay for emergency services in Canada. It doesn't apply to us, but important to know if we're ever traveling, right, in these areas. If the beneficiary is traveling, again, using Medicare's language, direct route without any delay, right? The person is not stopping in different cities between Alaska and another state, and the closest hospital that can treat the person in an emergency situation is in Canada. Medicare will look at that and they will issue payment, right? If it's medically necessary, and they will look at that claim. Now, the second bullet point, Medicare will pay for medical care that the beneficiary receives on a cruise ship if the person receives the care while the ship is in U.S. territorial waters. So this means that the ship is in a port or within 6 hours of arrival or departure from a U.S. port. So that's another thing when folks are traveling around, again, the way that Medicare views this if they're on a cruise ship, right? Very specific situations. The last one, again, this is the one that could apply to again, folks that live in the southern part of our state. So in limited situations, Medicare may pay for non-emergency inpatient services in a foreign hospital. And again, we put in parentheses, as you can see there, any connected provider and ambulance costs. The care is covered if the hospital is closer to the person's residence than the nearest available U.S. hospital. So if the person is really right on the border and it's closer to go to a medical center or facility in Mexico because it's an emergency situation and they need to receive that care, or it's a non-emergency situation, they need to receive that care and it's medically necessary, Medicare would issue payment. And again, we pose the example there for folks living close to the border in Mexico, folks living close to the border in Canada. So with that, let's move on to the next slide there. And this is where we get into the practice kind of piece of the training, the more interactive piece. So let's move on to the next slide. Perfect. So what I would like to do is kind of start with reading the narrative, the story, posing the question, and then kind of jumping into some of the responses that we have, and then engaging all of you with kind of your thoughts on what the best resolution response would be for this specific situation. So Miss Martin is 68 years old. She's living in San Juan County. She's enrolled in a Medicare Advantage plan. It's an HMO, so it's very restrictive in terms of people going out of network. They don't allow out of network. So though she's limited income, right, she's not receiving Medicaid benefits. So she only has this Medicare Advantage plan. On a day in early January, so earlier this year, Miss Martin was visiting family in Arizona. She became dizzy. She had trouble breathing. Of course, her family became really alarmed and they took her to the nearest hospital emergency room, right? So the ER staff, they treated her and they provided her with high blood pressure medication. That was the appropriate treatment that she needed. And then Miss Martin was surprised when she received the plan's explanation of benefits statement, right? Informing her that she would be responsible for the total cost because they were denying coverage for the emergency services that she received in Arizona because she was out of network, right? So the question is, what should Miss Martin do, right? So with that, let's move on to the next slide. And we're going to delve right in. And so I'm just going to review each one of the responses, and then I'm going to kind of pose it, provide the ball over to you all and ask for your assistance with kind of choosing which one of the responses would be most applicable here. So response A, Ms. Martin should pay out of pocket for the emergency services since it was her fault, right? She went out of network. Option B, Ms. Martin should call the ADRC, the Aging and Disability Resource Center, where my office is located, and speak with one of my colleagues in the SHIP program, the State Health Insurance Assistance Program, to have a staff member discuss the issue with her, right? Option C, Ms. Martin should plan to never travel out of state to avoid this in the future. So really just don't visit your family, just stay home, right? Option D, B and E apply. They're the best options here. Well, what is option E, right? Ms. Martin should use her appeal rights in this denial of coverage and fight the plan, right? I kind of like to include fight the plan. As an advocate, I enjoy fighting plans. So let's move on. Well, actually, before we move on, I would like, just taking a minute to ask everyone to participate and share your response to what you think would be the best option here to address Ms. Martin's concern. So why don't you take a moment, and I'm going to use our timer for 60 seconds. And thank you for the background music. I was waiting for it.
Yes.
And the minute is up. Thank you, everyone. I saw some really good responses there. And yes, I think the majority of you included option D, as in David. So B and E apply. And I saw many, many Bs. I saw many, many Es. I saw a B and E. So we're all on the same page, I think. The majority of us can see that B is a good option because the ADRC is a resource, right? And it's important to for Ms. Martin to receive information about how to appeal, for example. We can explain the appeals process and even help her in providing that documentation to the plan. And then, of course, the importance of her exercising appeal rights, because imagine, why would she pay over $700 if that's the dollar amount that they're charging her from this facility in Arizona? Why should she pay that when she has health insurance? So it is important for her to exercise her appeal rights and fight the plan in this denial, because the plan should cover emergency services even if she goes out of network. So that's part of the protections that she has as a Medicare beneficiary. So wonderful. So let's move on to the next case study. Great. So here I'm going to do the same thing. Let's start with the narrative. So Mr. Ojinaga, he's a 70-year-old senior enrolled in original Medicare. So not a private plan, original Medicare. He lives in Mora County, and he's also a veteran with access to veteran services. He gets dialysis at a facility a few miles away from his home. His wife and his other family members drive him to and from the facility. So he was surprised really when he was told by an employee at an ambulance company affiliated with the medical facility where he goes that he could receive ambulance transportation to and from his appointments via Medicare, right? Even though it's not an emergency. So Mr. Ojinaga kind of told them, he doesn't have a medical condition, a medical need during the ride that requires that type of ambulance, transportation. He also told them that he doesn't need help moving around. He doesn't use a wheelchair, for example. So he's not bedridden. He's not confined to a bed. So he told this to the employee, and still she insisted, you shouldn't have a problem getting Medicare to cover it. So what should Mr. Ojinaga do, right? What's the issue here? So let's move on to some of the responses that we have. So response A, Mr. O should contact the VA office to find out about local transportation benefits that he may be eligible for, right? Because he's also a veteran, he disclosed that. Mr. Ojinaga should proceed to listen to the employee and simply just schedule a non-emergency ambulance ride. Why not? Option C, Mr. Ojinaga should speak to his provider and his doctor, ask whether he is eligible for scheduled non-emergency ambulance rides via Medicare. What does the doctor say? Option D, Mr. Ojinaga should contact the ADRC, here we are again, and request to verify the information with SHIP, right? And find out about local transportation alternatives that the ADRC can, what is out there? What other resources can the ADRC connect him to? And option letter E, we have it jam-packed, right? Option A, C, and D apply to his situation. So the same thing we're going to take a minute to have everyone just kind of chime in via chat, feel free, and then we'll reconvene. And the minute is up. Thank you everyone for participating. I see a lot of E's for sure. I think the majority of the responses were E's, which is exactly right. Because again, Mr. Ojinaga should definitely contact the VA, right? Because it sounds like from what he described, he's not a person who's confined to his bed, right? So that could be a problem with non-emergency transportation. He's also not a person who requires the medical equipment to be transported, right? He doesn't need a reading of his vitals. He may not need that type of high level medical attention that the ambulance transportation system that requires that. So there may not be a medical necessity for him to get that. So maybe the VA, however. So option A is definitely relevant because I have some information to share that I know I've shared in another training, but because he's in Mora County, so the New Mexico Department of Veterans Services has launched the Rural Veterans Transportation Program to service medical transportation needs for veterans in the following counties. And you don't have to memorize this because I can send this to Dana as well. I know we have a flyer. Cibola, Colfax, Guadalupe, Harding, Mora, Quay, San Miguel, Socorro, and Union counties. So in this case, he's definitely within one of those counties that he can receive these non-emergency transportation services that are free to him that he may be eligible for due to his VA, his veteran status. Now, in terms of option C, Mr. Ojinaga should speak to his provider, his doctor. That's not a bad idea. His doctor may be able to provide him more guidance and explain to him, these are the Medicare rules and you don't qualify, right? Because you're not confined to your bed, because you don't need a reading of your vitals and other things that are important that the ambulance service can provide. And then option D, of course, it's the ADRC as a resource because we can connect Mr. Ojinaga to transportation services in his area, right? So we can do that research for him. He doesn't have to just stress about it by himself. We can definitely engage our staff to provide him with some of that other information. And of course, provide more information about Medicare coverage of this service. So with that, let's move on to the end of our training, really, just a couple of slides. And this is just a reminder slide of what we do as the SMP, because we're well versed in the Medicare program. And so and the Medicare rules, for example, and some of the protections to Medicare beneficiaries, we can help people dealing with Medicare billing issues and, of course, reporting scams. And we do this because we connect to our federal partners. So that's Medicare, the Centers for Medicare and Medicaid Services. We literally have direct regional contacts. I have their number. I can call them. And of course, the Office of Inspector General, where we can send that information about scams that people need help reporting, for example. And it's important to report something funny and weird that you're seeing on a Medicare statement because, it could be an error, it could be, abuse, or it could be a scam. And then, of course, we can help people with one-on-one if they're having trouble communicating an issue with their provider's office. Maybe there's something funny with billing and they need help. The Medicare beneficiary needs help with communicating that information to the doctor's office so that we can get the doctor's office on board, their billing staff, to ensure that that claim is properly paid and it's not just the person paying out of pocket, right? There could be an error that can be fixed. So with that, let's move on to the resources page. So these are useful resources that you may find. The first one is Medicare.gov, but the second one I find really helpful is through Medicare Interactive, which we use here at the SHIP and SMP program for the state. Medicare Interactive, the last bullet as well, is really helpful because they're consumer-friendly flyers, like really, really helpful information in layman's terms, right? So it's not as convoluted. And then moving on to the next slide. Thank you. So I always give a shout out to our volunteers because we can't do much without our volunteers that are embedded in their communities, that do peer-to-peer counseling, that kind of spread the message about the important programs and information about Medicare, and of course do other types of tasks virtually right now because we are just about coming back to normal. But if you want information about the volunteer program, I welcome you to email Dana and Dana can get in contact with me or let Valerie know. And I'm more than happy to provide more information about the program and what we do. We provide training and support for all of the volunteer work that our folks are engaged in. And with that, let's move on to the next slide. So you're going to have our contact information. Our 1-800 number is there. We also have an email and we also have a great web chat service. I mean, our staff is really wonderful with addressing quick minute. If you have I need to know what the number is for this, state agency, or I need to find information about this, sending it via web chat is a great way to get information quickly. And they can also make referrals to our SMP and SHIP programs. So you can kind of use the web chat system. They'll respond right away. And you can say, I'm having a Medicare billing issue. Who do I speak to? What do I do? And then they can connect with me, right? And they can send an internal referral. So with that, let's move on to the survey piece, which is always there because we always have to promote it. We always want your feedback. So if you have 3 or 5 minutes of your time, I welcome you to take the survey because we want to know how I did. I want to know if these trainings are helpful, if you have any, it's just a quick anonymous survey. It's all about just this presentation. And I, again, thank you in advance. And then with that, I'm going to open it up to questions. So if Valerie and Dana, if you'd like to or whoever would like to facilitate the questions and let me know what questions are out there.
We actually did have a question before, but you answered, and the rest were just responses to the case studies.
Yeah, that's what it looks like. Well, if questions should come up, or should you have an emergency, a Medicare billing issue concerning ambulance transportation, or some other type of Medicare billing issue, or any other type of Medicare issue, right? Coverage issue, or whatever the case may be. Maybe it's about denials. Maybe the person that you're caring for, or maybe if you're a person on Medicare and you receive a denial of coverage and you don't know how to appeal or what appeal rights are that are accessible to you. I would be more than happy to connect you with one of our SHIP counselors, one of our folks that are well versed in providing that type of guidance, and even assistance with helping you appeal. There's tons of materials that we can provide. And so, but as long as, you know, the takeaway here is that Medicare, people on Medicare have rights and they have plenty of protections. And so it's important for them to know that so that they can exercise those rights. Thank you, Dana, for putting the survey on chat.
For folks that may not have access to the chat, I did put the survey link in the chat, but I'm also going to put it in an email. I will be emailing out Samantha slides to everyone after the training, after I get the attendance list from Valerie to make sure I know who's here. But in that email, you'll get the slides, and then I'll also put all of the resource links that are on the slide that Samantha showed in that email, and then I'll also include the survey for any folks to complete the survey. This survey is different than the survey that Valerie or any of our recruiters brought up to you and asked you to fill out. This survey is specific to Samantha and her presentation and her programming. The other surveys are for our grant funders, the ones that Valerie sent out in the links that she sent you. So just so you know, they are separate surveys. Any questions or anything? Just want to make sure everyone has a time to ask any questions they may have.
I have one question. Would IHS or the hospital be able to provide, like, do they normally, or do you have to ask like for a counselor or somebody to do this, or it would be on yourself and the caregiver to reach out and find like a counselor or somebody to talk to?
Excellent question, Valerie. And I would say with IHS, this is where it gets incredibly, because what I want to say is folks that have both Medicare and have access to IHS, that's the best type of situation, because the Medicare beneficiary should have no cost sharing. Because IHS in that situation will wait for Medicare to pay, and then it will supplement anything left over. So really, the Medicare beneficiary who's using both systems, those systems should be talking to each other. And when IHS bills Medicare, you know, there should be no cost sharing. So really, I'm always like thankful and hopeful that people who have access to IHS and Medicare will have both, right? They'll enroll in Medicare, they'll have their Medicare to let the feds pay for their portion, and then the IHS program can supplement whatever's left over, leaving the person with zero cost sharing. So that's where, so in terms of your question, there really should be no billing issues in that scenario, right? There really should be no billing issues if the person is going to an IHS facility and they're giving their Medicare information, because Medicare is going to pay its portion unless Medicare denies. If Medicare says there's an issue here, we don't accept this because it's not medically necessary, the IHS facility did not provide enough information about documentation, that's a different story. That's Medicare kind of informing the provider, IHS, that there's an issue with the billing. That's kind of different. And in that case, I can see where the person may need more guidance, because that would turn into, it's Medicare, your primary provider that's paying. Medicare's is issuing kind of, we need more information, or X, Y, and Z is happening. This is why we're not covering this. But even in that case, when Medicare says we're not covering something, there's a reason why. They have to give the reason in writing. And that's where the SHIP and SMP program can, well, the SHIP program specifically would be of help. So calling the ADRC at that point, so now everybody hopefully knows that we're a resource to you, because if that should happen where Medicare as a primary payer says, no, there's a problem here, we're denying this, it doesn't mean you or the person you're caring for is going to, sorry, I put myself on mute. It doesn't mean that you should pay that bill, even if Medicare says you're denying it. I always say fight Medicare, right? And fight them with the appeal rights that you have. So don't pay that $800 or whatever it is. use and exercise your appeal rights to make sure Medicare gets the information they need from that provider, whether it's IHS or any other medical center or provider. Does that help, Valerie?
Yes, thank you.
Sure.
I'd like to add to that. I am 65, and so I'm dealing with this Medicare issues right now. And it is not fun, but I had to go back and appeal to get Medicare to pay 2 bills that I knew I didn't have to pay. I'm in New York, and they were billing me for items before I went on Medicare, and prior to Medicare, which is like maybe 5 months ago for me, my employer was paying 100%. And then I went on Medicare, and right away they were billing me saying, you have to pay this. And I'm like, no, I have to go back because I was not under Medicare at this time. And I had to go back and forth and appeal and everything. And finally they sent me a 0 bill.
Yay.
I had to keep, if I had not fought them, they would be putting me in collections.
Imagine.
I
Yeah, no.
had to fight on both ends. And now I'm really scrutinizing when I go to the doctor, the questions I'm asking when I go, are you accepting Medicare? And I have a supplement, Part D, because now I'm finding if you don't tell them, they don't bill Part D. They just do Medicare. So you really have to be on top of it when you go to these doctors, because they will bill you for what the second portion will pay. Yes, you might have a co-insurance, but until that point, let them pay everything, as you said.
Exactly. So that's the biggest takeaway, I think. And congratulations on your advocacy work.
Yeah, I did.
That is impressive.
I was on the phone every day getting names, and I kept going back and I said, send me a breakdown because I shouldn't have to pay this. And I'm still on them every time I get a bill. What's this for? Why is the doctor billing this? So I'm one of those advocates as a senior that's going to fight for my rights.
Wonderful. And for everyone else who has to deal with something like this, so if you feel like you need assistance with dealing with this, because sometimes this could be incredibly stressful, even for me in my employer insurance. If I should get a denial of coverage and they're charging me for, hundreds of dollars for the care that I've received, it is incredibly stressful. So, but that's what we're here for. So for all of you that are on Medicare or who are caring for people on Medicare, I just want to emphasize that the ADRC is available to provide those resources and walk folks through that process, right? Because not everybody, Elizabeth, imagine has, your advocacy skills or can do that because maybe there's so many other things going on and the stress and the anxiety. So I welcome folks, like we can also provide that support.
And I'm going to share this information once we get those pages, the emails and the numbers, because a lot of seniors don't know, really. They don't have anyone advocating for them. It's truly.
Exactly. And it looks like, Ariana, you shared in the chat that your mom is dealing with this right now. So again, I welcome you to, let Dana know, let Valerie know so that they, if you want to communicate with me, I'm more than happy to reach out if you want to share your contact information. If your mom is still dealing with this and you feel like you can use a little bit more guidance, I'm more than happy to connect with you and then connect you with one of our SHIP counselors who can provide that one-on-one assistance and assess, well, what are important next steps? What are your options? What are your mom's options?
Definitely. Thank you for that, Samantha. I'd also like to just note and let people be aware that time sensitive, you have to be on it as the caregiver, as the person that's taking care of your loved one or your person. You have to be time sensitive. You can't leave these. If not, you're going to easily rack up a $10,000 debt and $100,000 debt. So that's why I was saying why, IHS, do they provide somebody? You as the caregiver really have to be that advocate. And thankfully, like Samantha is here, and we have a wonderful example of Elizabeth. If you're wanting to do it on your own, you need to do it. If not, Samantha and her team is here as well. So you need that help. You have to get on it. You have to, if you don't, I'm telling you right now, even with IHS and on the res, A lot of people think that you just get free and you don't have to worry about anything. It's not true. So just keep that in mind, and just want to note that. So thank you.
All right. Well, everyone, thank you so much for joining us today. And thank you, Samantha, for another great informative presentation on Medicare. I do want to note that Samantha is good this month. Normally, Samantha does only one presentation a month with us, but we're lucky we get her twice this month. So if anyone is interested in coming back, she's doing a different presentation on the ADRC, which is the Aging and Disability Resource Center here in New Mexico. She's going to go over their programs, what they offer. She'll also go over what the SMP, the Senior Medical Patrol does. She mentioned SHIP in her answers, so she'll kind of go over what those organizations do. They're all resources to people. We do know that lots of the folks joining here are not in the New Mexico area, but Samantha and her team do have access to connect you to your state's resource centers as well. So if anyone's interested in learning more information about what kind of resources, I would suggest coming and registering for our March 18th ADRC review, because that'll be more about just sharing what resources are out there and what stuff you can access if you have questions for yourself. But thank you all for joining us. To note, you will get a certificate for this class, but I am doing certificates monthly only. So you'll get certificates at the end of the month after our last March class is over with, and then you get a package for the whole month for whatever you attended during the month. But thank you all. I hope you have a great Friday and a great weekend.
Thank you all. Be well.
Thank you. You guys can blow on out of here now. It's still windy in your area. I know it is for me.
Stay safe, ladies.
Bye. Thank you.
Have a good afternoon.